Recently, there's been a lot of attention on one colonoscopy facility where faulty techniques were identified. I am just as concerned about the safety of my patients, and yet when I think about the vast number of cancers that could be cured with a screening colonoscopy, I am even more concerned about the possibility that there will be a large increase in the number of patients who will be diagnosed only after they experience symptoms. With early detection, the cancers are found at an earlier stage, and this will increase the cure rate. So the latest patient survey says that the number one reason that people don't go for their colonoscopy is because of just anxiety about the test.
I think in our community there's a challenge now because there's a certain lack of consumer confidence that's developed, and we have to overcome that hurdle in the office and spend a little extra time convincing patients of the benefits of these procedures.
There have been patients that have been refusing to have colonoscopy that even have some symptoms that are worrisome, and they're just afraid that they seem to be more worried about getting a disease that really won't kill them as opposed to a disease that can kill them. Colon cancer, once it gets beyond a certain point, the treatments just don't work anymore. I think one of the safest places in the United States to have a colonoscopy right now is Las Vegas.
Absolutely.
Because I don't think any place is more supervised in what they do. And now that the place that caused the problem has been taken out of the equation, I think there's no place safer. We're doing probably twice as much as far as checks and balances go.
As doctors, we often talk about the stage of the cancer. This tells us how far advanced the cancer is when it's diagnosed. Colon and rectal cancer have 4 stages, as well as a precancerous stage called, of course, stage 0. Everything starts with a biopsy at the time of colonoscopy. Stage 1 cancer is when there is definite invasion of the cancerous cells into nearby tissues, and that this invasion has not gone through the wall of the bowel or into the lymph nodes around the colon. Stage 2 cancer is when the tumor has spread deeply into the wall of the colon and rectum, but still has not spread into the lymph nodes. Stage 3 occurs when the cancer has actually spread into the lymph nodes. A cancer is stage 4 when the tumor has directly invaded other organs nearby or has spread to other parts of the body that are unrelated to the bowels at all, such as the liver or the lungs. It is important to realize that almost 40% of all stage 4 cancers are still curable despite the advanced stage at the time of diagnosis. So it's often not a death sentence.
I had a couple come into the office a few weeks ago, and I had a really tough time convincing the gentleman to go ahead with the colonoscopy. James, your annual exam went great, your lab work's fine, there's one more important topic we need to cover. I know you're turning 50 this year, and Amy wants you to get your colonoscopy done, and so do I.
It's important.
I'm not doing that, there's no way.
Doing a colonoscopy ahead of time can help prevent colon cancer.
I'm not doing it.
As you know, it's recommended for everyone age 50 and older regardless of symptoms, and I think it's recommended for younger folks who have a family history of starting at the age of 45, 10 years prior to the youngest family member with a tumor. And certainly colon cancer is unusual in that age group, but not unheard of.
Many patients ask why we picked the age 50. Why 50 years old? And it's because the majority of cancers that we see occur in the age of 60s. And so we think that polyps, those are the precancerous growth, take about 10, 12, or 15 years to grow into cancers. We're not sure what triggers it, but somewhere along the line, this polyp that's growing turns into a cancer and then starts to attack the body. So we've taken the age of 50 to mean that we could get the polyps out and not the cancer.
Almost all stage 0 and stage 1 cancers are curable, and more than 60% of stage 2 and 3 cancers are curable as well. So don't avoid having a colonoscopy or a cancer screening test because of fear, because whatever the stage and your symptoms, we have a very good chance of curing you.
Today I saw a wife that actually saved her husband's life by talking him into a colonoscopy. He went and had the colonoscopy, had a very large tumor, It was biopsied, and I took it out surgically, and it was a dysplasia instead of a cancer.
Yeah, mostly it's men who seem like they don't want to go out and get that colonoscopy. They're embarrassed, or they don't want the prep, or whatever. Huh? It's definitely time for the wives to lead the way.
I think it's important to explain to patients too that this is not a tumor that you could find with a simple exam. It requires that good look with a specialist to find those lesions.
Recently I was at a conference and they had a panel of professors from different major medical facilities, and they did a survey to find out how each would be like to be checked for colon cancer. So first the moderator asked about fecal blood testing, and nobody raised their hand. And then second, they mentioned flexible sigmoidoscopy, which only covers up to about a half of the colon. Nobody raised their hand. And then actually, they asked about virtual colonoscopy, and one of the professors raised his hand, and he kind of hedged it. And then when they said colonoscopy, all the professors said that they still felt that that was the gold standard to detect colon cancer and the pre-colon polyps that we developed.